A pleasure to have you join us today on the program Healthy Living. I'm at this here. You know, on the street when we see some kind of dentitions, what do we say? Ah, scatter teeth, all of that. There are so many things that happens with the mouth, and a lot of us really don't know what to do. Apart from common malaria and other illnesses, people don't like to go to the hospital to do one or two. But there are so many things you can do for yourself. There are so many corrections you can make medically. But we do not take advantage of all of this, maybe because we don't have the information, or perhaps we just don't care about our health. All right, but today we're going to be doing something different from the usual so that you know exactly where to go, what to do when you have issues in that area of medicine. So today we're going to be looking at malocclusion. What is this? It sounds very big, but if you sit tight and watch this program to the end, you may just be able to know what we want to talk about today. So join me as I make welcome to, I wish I could say gentle women. That is reserved for men. Anyway, two beautiful ladies in the house today who have made their names, who have made their marks in the sands of time, and who are still doing exploits in medicine. And this is the point where I say, go woman, girl power. All right, join me as I make welcome Professor Idia Izeyamo. She's a professor of orthodontist from the University of Benin, and of course, University of Benin Teaching Hospital. So, two ways. You're welcome. Happy to have you in the studio.
Happy to be here.
I'm so delighted to be sitting
here
with you in the same hall.
Thank you.
All right. I also want to make welcome a beautiful woman. She's Professor Alice Uwemi. I hope I got that right.
Yes.
All right. She's a professor of orthodontist too from the University of Benin and, of course, UBTH. And it's so good to know. It's so sweet to know. And I'm so proud to know this and to announce this to you, that she's the first female orthodontist in Nigeria. I'm so delighted to have you in the studio. You're welcome. All right, so we want to look at our discussion for today. So when we're talking about malocclusion, exactly what are we talking about now? Let me throw this to you, Dr. Izeyamo.
Okay.
Or Professor Izeyamo, sorry.
Thank you very much. When we talk about malocclusion, we talk about the occlusion being deranged.
Okay.
It means the teeth may be scattered, the teeth may be climbing each other, the teeth may not bite properly, the teeth may not be able to chew food,
Okay.
and it affects the self-esteem of whoever has such teeth. They cannot smile, they cannot eat properly. So the occlusion is moving away from what is normal, and that's why we call it a malocclusion.
Okay.
What should be normal is malaligned, so it's not aligned properly. So that's basically a very simple definition of what malocclusion is.
Okay, Professor Wemi, let me ask you this. Can we know the cause of all of this?
Yes, thank you very much. But before I answer that question, I want to say that I'm the first female professor of orthodontics in Nigeria.
In Nigeria.
The first of orthodontics.
Okay, the first male professor. Thank you for that correction, yeah.
Yeah, the reason for malocclusion can be genetic, that is inherited
Okay.
from parents. It can be from environment, that is factors based on habits.
Okay.
For instance, you're talking of inheritance. Some mothers have small jaws,
Okay.
normal sized teeth, whereas they have husbands with large jaws, large teeth. So when they have a child, it's likely to inherit the small jaw of the mom and large jaw of the dad.
Okay.
So there is a discrepancy. So you now have either overlap or excess spaces, or the jaw is protruding more than the regular one. So they're not likely to be able to close their jaws because the teeth are protruding.
Okay.
And there can be some other causes like habits. Some of our children are chewing sucking our tongue,
Okay.
sucking our fingers. And so these are likely some of the local causes that can cause malocclusion.
Okay.
And then the one that is not very common is the fact that you have some birth defects,
Okay.
like cleft palate, for example, that can result in malocclusion.
Okay.
As a child reason.
All right, the doctor, professor is Eyami. Let me, don't mind me if I say doctor. Of course you are a doctor. Now let's look at the types that we have, because I have seen some persons, and this condition is not usually same in people. Yeah. You have some, like Professor said, some will just, push out. You know, like the one we call Dracula teeth on the street, you know, to just push out. Others will go in, then some will be on top of each other. I know that there are types. Can you just explain the types to us?
Okay. Each patient is unique, as Professor Weni has said, in that some patients, as a result of a genetic condition, may have some discrepancies. Some, the teeth actually push out. Some, the teeth, the bite is reversed. Some, the anterior teeth do not bite properly. Such patients cannot even eat corn. They cannot bite on anything with their front teeth. That's what we call an anterior open bite. Some, the teeth are overlapping, and then they are crowded. Maybe that's the one you call the Dracula teeth. Some, the teeth are pushing out too much, so the patient cannot close their lips. And you find the parents always using their finger to hit the mouth of such a patient and say, close your lips. But it's not possible for the patient to close their lips at that point in time because the teeth are coming out too much. Then we also have some cases where we have spacing. So you have, the patient has gaps all over the mouth. Then you have some teeth that are in the wrong position. Some may come out in the roof of the mouth. Some may come out too far in front. We also have some types where we have multiple teeth, where you have both the baby teeth and the adult teeth in the mouth at the same time. So sometimes children may call such people double teeth. And they always give them all types of nicknames which can be psychologically traumatizing to the patient. So that's just a brief summary of some of the types of malocclusion that we encounter.
That's right. Okay, is it possible to have a cure for this?
Oh yes, that's why we are here to...
But some persons don't believe. They just say, it's natural, let's leave it that way. A lot of persons would not want to.
Well, a lot of them want to, but they do not have the knowledge about what to do or where to go. So many of them, they don't smile. If you look at a group of people in a picture, you will find the person that has the malocclusion, the one with the tight-lipped smile. The ones with the beautiful teeth will smile and show the white teeth. So many of them, psychologically, it affects them. They don't know what to do. They don't know where to go. They don't know who to reach out to. So they go to quacks who worsen the matter. So we are trained orthodontists, and we are trained to treat these kind of problems. So what we tell people is that it doesn't matter the problem. It doesn't matter the type of problem that you have. It is treatable. What we use is we use appliances which can be removed by the patient, or the ones that can be fixed by the patients, which are the ones we call braces, on the teeth of such patients. Those braces are little metal buttons which correct how the teeth appear in the mouth. We also have a modern method which we call the clear aligners, which you can also use to treat this malocclusion. It's not age dependent. So it doesn't matter how old you are. If you're not satisfied with your smile, you can do something about it.
So somebody like me can do something
Definitely.
about my own.
Even a 70-year-old can do something about it.
Can?
Yes.
Okay, now let's look at braces, Dr. Weni. People have argued that braces don't sit well on them, or maybe sometimes they have issues chewing with braces, and some have said that after removing braces, they don't feel the same. Is it a myth or a fact?
Well, I think it's a myth, because braces depends on like what Professor Isaiah just told us. You have fixed braces, you have removable braces. That means the patient can pull the braces and remove it at will. And the others that we fix and different designs. And once we put the braces there, we ensure that we maintain these braces, maybe a monthly basis, just for review.
For how long can the braces sit in somebody's mouth? It
depends on the malocclusion. Some for 6 months, 1 year, 18 months, and of course depending on the age of the patient. As if you are dealing with a child with some bones. the teeth movements are faster.
Okay.
When you are doing it another like myself, bones are already there. So the movements are slower, and so likely to take a longer time.
Okay.
But all the same, they are all treatable.
Okay. Please go ahead, we're listening.
So what I'm trying to say is that if whether we are using the bisolent type that as mentioned by Prof. Iseyamo, or we are using the fixed braces, metal braces like the stainless steel, or we are using ceramic, whichever one, we are able to get optimal results depending on the patient's demand and malocclusion.
Okay, if I'm not pleased with my dentition, is it possible to pull everything out and have a replacement?
That is not our area, because we are not interested in removing people's teeth.
And replacing?
Remove teeth within the bone.
Okay.
Without any remarkable discomfort. That means we are moving the teeth under physiological condition.
Okay.
Because patient will not even know when the teeth are moving.
Really?
Just have noticing that over time the teeth positions are changing and changing for the better.
You know, growing up, I used to have this funny dream that it's my dentition, I don't like them. I wish I can just get somebody to pull everything out and then just give me something different, something nicer. Because I see some kids in class and I'll be like, wow, this is beautiful. Why is my own not so fine? Is it not possible for me to get a doctor to have everything removed and then just give me what I want, what I'm pleased with?
In fact, that is one of the reasons why we are here, because some patients insist on teeth being removed and replaced with artificial teeth, just because they are not pleased with the occlusion that they have. But that should not be the pattern, because at the end of the day, if you remove the natural set of teeth and you put artificial one, you end up maintaining those sets of teeth for life. And of course, you have the disadvantage of replacing them from time to time. Maybe the artificial one is not as good and strong as the natural one.
Okay.
As orthodontics, our aim is to ensure that your natural teeth are kept properly positioned so that you can smile properly and be happy.
Okay, to smile in public is good. Like doctor said, there are some persons who will not smile in public. What about those, you know, maybe because of one accident or the other, they kind of lose some teeth from their mouth? Is it possible for us to do something permanent for those? Because I know somebody who used to remove, I don't know what they call that.
The denture?
The denture, yeah, the denture. She will pull it out and then put it in some kind of liquid before she sleeps. You know, sometimes, you know, like if I knew what I knew now, I would not, you know, mess with her life, you know. And we have a way of just seizing the thing inside the denture, inside the liquid, go and hide it somewhere, and then she'll be looking for it. Is it not possible for such a person to have it permanent in the mouth, instead of having to remove and keep and, you know, like that?
Well, that is implantology, where you can have a permanent replacement.
Yes, permanent replacement of the teeth instead of using dentures.
Our interest as orthodontists. That is for the restorative dentist.
Okay.
But as a team, we work together. There are some patients that require orthodontists, and at the same time, restorative procedure like implantation of teeth. What we call implantology. Instead of putting artificial teeth that you remove and put back, they are screwed into the bone and they are there as if they are permanent teeth.
Okay. And nothing will happen. Okay, these set of persons, you know, they will tell you don't drink hot thing or don't eat cold food. Let me ask Dr. Iseyamo, you don't eat hot food, you don't eat cold food. Is it true?
If you are asked to do that, there must be a reason. But there should be no reason why you cannot eat hot or cold. There should be no reason. You should be able to eat anything hot, anything cold. And if you have problems in doing that, then you must see your dentist to find out what the problem is. There might be some areas of sensitivity which needs to be dealt with so that you can live a normal life. Such a patient means the function is disturbed. And then you must see the practitioner so that the correct function will be restored. It might just be a simple filling, might be something that is so minor. When you put braces in your mouth, you can eat anything.
Okay.
But it's a little bit restricted in that you can only eat things that are not too hard. Remember, the braces are little buttons that are cemented on the teeth.
Okay.
At the completion of treatment, the braces are removed, and then you have your teeth back in the new and perfect position. So we are moving the teeth from a wrong position to the correct anatomical and physiological position that will give the patient a good and confident smile. So the patient can drink hot, can drink cold. If they are not able to do that, something is wrong, and it's not a function of the appliance being in the mouth.
Okay. All right, what's your general advice to the public now?
Well, we want
Because
to...
some of us do quite a number of things with our teeth. We open, drink, we tear sachet of us, whatever, anything. The teeth does quite a number of things.
Okay, general advice to the public. If you cannot tear the sachet of water with your front teeth, means you have an orthodontic problem. You should come and see the orthodontist. You cannot use your front teeth to tear that sachet of water or the packet of biscuits. You must see your orthodontist. You have an orthodontic problem.
It's a problem.
It's a problem. If your teeth are climbing on each other, you should see an orthodontist. Don't go somewhere and start taking them out. You will only worsen the problem, and you reduce the number of teeth in your mouth, and you reduce the function, and the smile will be worse.
Okay.
Don't take out all your teeth if you think you have a problem. When you don't have teeth, you have a bigger problem. So keep the teeth no matter how deranged they may be. Come and see us. We'll do magic. We'll rearrange them. Yes, we will rearrange them, because that is our job and that is our specialty. No matter where the tooth is, if it's high up, it's low down, it's at the back, it's at the front, it's at the side, there's spacing, you can't speak well, your tongue is coming out, come and see us for an evaluation. Most of these cases, we can actually treat them orthodontically. It's very simple. We put the braces in the mouth. Depending on your condition, the type of braces that we select for you, because we have numerous types. So when you see us, we'll be able to give that evaluation and give that advice and tell you how long your treatment will last and what you need to do. It's not selective. It's for the young, it's for the old, it's for the aged. If you don't feel confident about your smile, come and see the orthodontist and we'll do something about it.
Okay. All right, before I let you go, Professor Uwene, let me ask you this one. You know, a lot of us see gap tooth as fashionable. We like it. To the point that at a particular point in my life, I was using coin to see if I can create one for myself. You know, how dangerous is this? Because people still do it to today. And some go to
beauty salons.
Yeah, they go to beauty salons to, you know, file it and get one for themselves.
Open teeth, as it's popularly called, or what we call midline diastole. In terms of our profession, orthodontically, it's a malocclusion.
Really?
Can be closed.
Yes.
But it's beautiful. A lot of us, I love it.
So
wow.
It's termed malocclusion. It's one of those that needs orthodontic care. You have to close it. But incidentally, in our environment, they want it created. And I've seen many patients approaching me to create open teeth for them. Let me use that word. They're ready to pay anything. But we try to advise them that it's on its own, it's a malocclusion, so it shouldn't be treated. But if you have one and you like it, leave it. Okay. That's my counsel. I found out that many people, particularly from the eastern region of this country, they love it. I remember one of my patients' father telling me that if you close my daughter's open teeth, she cannot be my child anymore because she will not look like us. That's to tell you how some tribes or families cherish this midline
open teeth, so to speak.
But to actively go and create it is very dangerous. Okay. I also see so many cases where they went to beauty salon using nail files, using drill to create it, and the end result is that the teeth were infected, mouth swollen, and so at the end of the day, the teeth were extracted and removed. They lost this. Imagine somebody losing the front two teeth.
Can be very devastating.
Thank you very much. So, my counsel, please, if you love the open teeth, you can leave it. you don't have any other problem. But don't create it by yourself or go to beauty salon to try to create one. You will be increasing your problem.
Okay. Perhaps that is why I have some kind of sensation in my front teeth.
That is just
so I need to come and see you.
You need to come and see us.
Okay.
Yes.
That's fantastic. All right, people. I wish we could go on and on, but time is not our friend. How expensive is this treatment?
Well, not too expensive in the sense that...
Is it what everybody can afford? Because the first thing somebody will say now is how much? Is it
considering
expensive?
the time and the expertise, the service, and the outcome, I would say it's not expensive.
Okay.
Because if you were to have 6 months treatment, and because you are paying one, you make it look as if it's expensive.
Okay.
Really, it is not expensive.
All right. So, what's your advice on us who don't like to see doctors when it comes to our mouth and our teeth? What do you tell us?
Please visit the dentist.
I have never seen one. I keep telling my friends that I've never seen one. So I should learn.
At least every 6 months.
Every 6 months, everybody.
You don't need to have any complaint whatsoever before you see a dentist.
Okay.
Every 6 months.
Okay.
And for children, 4 months.
Every 4 months, and for adults, every 6 months.
Yes.
All right, ladies, our time is up. Thank you very much for finding time to be with us. We'll do this again. There's definitely going to be a part 2, so that all and sundry will be aware of how to get treatment when they have any issues with their mouth or with their teeth.
Yes.
Thank you. All right, people, this is what we're going to do today on the program. There will be a repeat broadcast tomorrow on GoTV channel 140, and you can hook up to our channels on YouTube to watch this program. We'll see you again soon. Bye-bye.